Hello, this is my second lab video for IYM. I pretty much the same as my first video with one person, but with two people. You would just want to designate your head nurse first off. So they're the one giving a command, they're giving the directions. And the second nurse just needs to simply follow the directions and go from there. So with the two-person, again, it's very much the same. You want to make sure the bed is at a right height for the patient. You want to make sure their bum's right on the edge, feet are flat, they're wearing proper footwear, bread rails are obviously put away, wigs are on the bed. The equipment, if you're using anything, is just, you want to make sure also the floor is very clear of obstacles for both the nurses and the patient. That's important as well. So with a two-person, you would obviously put the transfer belt again around the waist for the patient, or on the nipple line, or underneath, wherever it works for you, but preferably the waist. You're going to instruct your patient well before you get started that these are the command words. We're going to go 1, 2, 3 command word. Okay. So the first nurse is going to tell the second nurse, okay, this is what we're doing. You're going to have one nurse on one side of the patient, get the primary nurse holding the patient and holding the belt like they're supposed to. The second will be on the other side. The patient themselves, again, need to be looking forward. And if it works, they can help push themselves out the bed as well, just to add that little bit of stability. So it would be 1, 2, 3 stand. So the group of 3, everyone stands together. The two nurses working synchronously together to make sure that's nice and fluid. And then again, if we're going to pivot, we're going to go 1, 2, 3 pivot. We're going to move the patient, pivot, 1, 2, 3 sit, and then we're going to sit the patient. So when you're sitting the patient, you want to make sure the legs are close to the back of the chair, and then they can just sit directly down. So that's something to note. So I think the main thing for the two-person one is that you just work together. You're making sure you're communicating properly so that everyone knows what's going on and there's no mistakes. Everyone has their wide stance, slightly bent knees, making sure we're not taking all the weight of the patient, but simply supporting them and there for them if they do fall. Or like if they stumble, okay, then we go back, we make a new game plan. Having the two people is more beneficial for someone who can't bear the weight as well, just because there's one on each side. It covers your bases a little better. And that's that.